This is Health Yeah, your weekly update on what's going on in the health, wellness, and medical world with Monica Robbins.
When you think of infertility, you likely assume it's a woman's issue. However, it's more common in men than you might think, and it's something we as a society don't talk about enough. Our expert is here to help erase the stigma. Also, a Michigan man struggling with infertility shares what men should do early to find out if they have an issue.
I would say probably as soon as you turn 18.
And over the last 50 years, sperm counts have dropped. We'll look at ways men can protect their fertility. Plus, struggling to conceive can take a huge mental toll on couples. We'll share what you can do to support the loved ones in your life.
It's amazing how much listening and being present is such a powerful and supportive thing.
It's all straight ahead on Prescription for Life. Hello, and thank you for joining us. I'm Monica Robbins. Infertility is an issue facing many couples across the country. We often think of infertility as complications related to the woman, but doctors say problems with the man cannot be ruled out. In fact, across racial and ethnic groups, 1 in 6 couples who are struggling to get pregnant, a third of the issues comes from the woman, a third of the issues comes from the man, and another third is unknown. Different tests can be done to explore what might be causing the problems, and we'll get to that and much more with our expert. But first, a couple in Michigan shares their struggle and their hope to overcome infertility and conceive.
For many couples, starting a family is an exciting time.
I wanted kids young.
But for Austin and his wife Aubrey, things didn't go as planned.
We started trying and trying and trying.
A fertility test revealed Austin had low sperm count, and in vitro fertilization was their only option.
We had our first embryo transfer and it didn't work, and it was heartbreaking. And then our second transfer, we had 2 embryos implanted and 1 took, our daughter.
After nearly 2 years and 2 rounds of IVF treatments, Austin and Aubrey's daughter Larkin was born. Mom Aubrey shared this picture showing every shot it took to bring their daughter into the world.
And it was just amazing that the science has actually come this far.
Austin isn't alone in his struggle. In the last 40 years, sperm counts in men have dropped by nearly 60%, according to a 2017 study by Mount Sinai University.
All right.
Dr. Valerie Chevelle, a fertility specialist with the Fertility Center in Grand Rapids, is seeing the trend.
Definitely, we're seeing a lot of sperm counts that are lower, decreased motility. I'm starting to send off more samples to look at DNA fragmentation, and so we're definitely seeing more of it over the years.
Research shows about 30% of infertility among couples is due to low sperm count.
Right.
In her lab, Dr. Chevelle shows us the evidence. The left is a recent sample with only a few sperm. The right is a healthy sample. On the day we visited the lab, the majority of samples had low sperm counts.
I don't want men to feel like they're all alone in this.
Dr. Chevelle says there are many potential causes of low sperm counts, from stress to obesity, genetics, even our environment.
Definitely, there is a role of the toxins that are in our environment, and we know that there are certain toxins that can cause DNA damage in sperm. BPA, for example.
BPA is found in almost everything, from plastic food containers to carpeting, shampoos and body lotions, even our bottled water. So what can men do to protect their fertility? Eat a healthy diet, exercise, and lose weight.
It can help. It might not completely reverse the damage that's done, but sperm production start to finish is about 70 days or so. We can definitely see an impact and changes, but it does take time.
In addition to those changes, Dr. Chevelle recommends men have their fertility checked early.
They could have a semen analysis done to find out more about their fertility, even if they're not ready to father a child, just to have that information.
And Austin agrees.
I would say probably as soon as you turn 18, more than likely you should go in and see if it's an option to even have one.
Austin and Aubrey are already planning for baby number 2. Aubrey is preparing to go through another round of IVF treatments.
It's hard, emotionally, physically. Without it, though, we wouldn't be where we're at. So I'm thankful that it's an option for us.
Fortunately, it's an option for many men who are struggling with fertility.
A recent study found that most men have lower sperm counts today than 50 years ago. Studies are beginning to shed light on what may be to blame, and doctors say it's more than just one cause. Diet plays a role, as well as environmental toxins.
Plastics and other substances that can have an estrogen-like effect that are getting into our food chain.
Doctors also say a heart-healthy lifestyle can help improve sperm health. Still ahead on Prescription for Life, our expert gets into why it's so important to understand male infertility. And we've heard of freezing eggs, but sperm? Is that really a thing? Our doctor explains. Although doctors say infertility is a common problem, it's definitely a personal problem. Many men may be too embarrassed to discuss it with anyone. Our expert is here now to shed some light on what can be done to erase the stigma. Joining me now is Dr. Scott Lundy, a urologist with Cleveland Clinic. Thank you so much for being here.
Yes, absolutely.
A lot of questions to get to because this is a topic that a lot of people really don't want to talk about. So when we talk about infertility, usually we're talking about the woman who's having the issues. So how common is it that it's the male problem?
Sure. So our society has dictated that infertility is a female problem, but as we both know, it takes two to tango. And if we look at the numbers, over half of all cases of infertility have a male factor that's either the only problem or one problem from each of the partners. And this is really common. About 1 in 6 couples in the world struggle with this. So if your friends aren't talking about it with you, it's not because they aren't going through it, it's because it's been stigmatized and because we don't have a society that welcomes a dialogue about this.
So what causes it? I would assume there's a myriad of reasons.
There are dozens, if not hundreds, of causes of male infertility. And so a big part of our job is trying to understand that when we see these men. It can be things like environmental exposures or activities like smoking, for example. It can be something as simple as a fever or an infection can impair fertility for months afterwards. It can be, of course, genetic or indwelling problems within the testicle. Or it can be functional problems where, because a couple has struggled for so long, we've turned a job, an activity that's pleasurable into a job, and they can't have an erection, and they can't physically have the ability to have a child because of that. So there are lots of causes.
So you brought that up because I hear the commercials on the radio and on TV all the time about erectile dysfunction. And, you know, is that a cause of male infertility as much as maybe ejaculatory dysfunction,
Sure.
that sort of thing?
So in order to have a chance at a pregnancy, the male component, the man, has to be able to have sperm in the ejaculate, has to be able to place that ejaculate in the right location. And that is multiple steps all combined into one. So either the sperm is missing, which can be one problem, or perhaps he's unable to have penetrative intercourse because of erection problems. And that can either be due to injuries or illnesses, or it can be due to the mental component of feeling like you're failing at the job of being a man, and that interferes significantly with erections. Or climax happens too early or too late, and that can be something that the man was born with, or it can be a medication, or it can be a number of other causes.
How common is that?
Pretty common. And again, something we don't talk about a lot, but we see many men, and this can be something as straightforward as I climax too fast, and we have treatments to help with that. And that's more of a quality of life issue. Or I can't climax, and we delve into why. And perhaps it's due to a medication for depression or other medications that can cause that problem.
So does it surprise you that by the time a man gets to you to talk about these issues, he's been dealing with it for months, if not years?
Not surprising at all. I've seen couples struggling to conceive for 12 years before they come to see somebody. And by then, the march of time has continued and we're facing an uphill battle. I've seen men with erection problems who haven't wanted to discuss these issues for, again, decades. So the stigma is absolutely harming patient care, and it's something that I'm on a mission throughout my career to try and change.
So it really helps that we are seeing these commercials on TV and they're starting to get out there, and at least younger people are talking about it. What kinds of behaviors are affecting the sperm count? You talked about smoking. Is there anything else that, you know, is a known no-no, if you will?
Smoking is a big one for us. It's one of the few parts of medicine where I can get a printout of lab values and I can point my finger to the one value that the smoking is impairing. And it's really striking to give a number to a patient where they see an abnormal value, not just the cough or the other health effects, but a number. Marijuana is another one. We're learning that it impairs in fertility and sperm production through a variety of methods or mechanisms. Obviously, less is better, daily is worse. We don't know if edibles or other things are bad. We presume that they have negative effects, but how serious those are, we don't know. Other activities can impair fertility as well. Hot tubs, for example. If a man enjoys a hot tub every single day for 30 minutes, we know heat impairs sperm production. And even just a few degrees can prevent those sperm from maturing during their 90-day production cycle and impair fertility for 3 months afterwards.
So what's your advice to a man who is, you know, wanting a family, considering a family, and maybe, you know, they're having trouble conceiving, yet it's not his problem?
I think there's always a dynamic between the two people involved in this process. Typically, one is pushing for more interventions, more testing, one is not. Most commonly, that's the female partner who requests or sometimes demands that the male be seen. From our perspective, because of the common nature of male infertility, we really do want to have both people in the couple assessed at the same time because it saves time and helps do a more comprehensive workup for these patients. So I think that's first and foremost most important. Secondly, we have to recognize this is a stressful process, and when a couple is given the news ultimately and unfortunately that they're unable to conceive, that news is every bit as devastating as a cancer diagnosis. We've shown that with data. And so it's really important for us to recognize the psychological component of this and the stress of this, and acknowledge that and encourage the couples that we see to turn to each other or to outside help like therapists to help, because this is a stressful process, and that stress alone often makes the fertility job harder because cortisol and body's response to stress is to sometimes impair fertility itself.
So we've seen that birth rates in the United States are seemingly going down. Worldwide, though, is it true that sperm count is going down among men?
This is a great question and one that's received a lot of press lately. We do know that in many countries, the birth rate is slowing or even inverting such that the population will shrink. And in other countries like Japan, for example, this has become so severe that the government has now supplemented payment for infertility services, whereas here, most of this is still out of pocket and a huge financial expense. So whether the problem is about wanting children or whether it's about an inability to have them is a difficult question to answer. It's probably both. We do believe that in some cases sperm counts may be declining and have been for many years now, and there's some data to support this. I think a lot of the reports on this topic have been almost catastrophizing the issue. And for every study that suggests a drop, there is another study that suggests there isn't. And so we're still trying to understand that. And in our research lab, we're actively trying to answer that question right now. My hunch is that there is a decline, and that's likely due to the additional medical problems that we're facing, the epidemic of obesity, the stress that we're all under. These things do manifest themselves, but that it is not as dramatic of a decline as perhaps some news stories would report.
You mentioned that a lot of this is out of pocket for, especially for IVF treatment or any type of infertility treatment. Is that the same for a man who just wants to come in and get checked?
So we're lucky in our state that much of the diagnostic testing is covered. In many states, that's not the case. Now, on the other hand, some states are mandated to cover care for fertility as well, including IVF coverage. And I think that that's really important because we have stigmatized fertility as in our society, but we've also chosen not to identify it as a disease and allow medical coverage for it, and that's heartbreaking for me. So I see a man in my clinic and he has 0 sperm in his ejaculate. He's facing an uphill battle, and maybe his partner is 38 or 39 and reaching the end of the window where we can help them conceive. I then have to, in that same visit, tell him that in order for him to become a biological father, he has to pay thousands of dollars for his care in addition to the tens of thousands of dollars for IVF care. And that's a really difficult discussion to have, and one I wish we didn't have to have.
Age is not a factor, though, when it comes to sperm, is it?
It is, but not as significant. If we think about age, the age of the female partner is far and away more important, and as women reach into their 30s, and particularly their late 30s and early 40s, fertility declines. And that's because the eggs that that woman has available were with her from birth. Sperm are simpler, easier, more straightforward. They're made every second, and men make 1,000 sperm every heartbeat. But as men age, their counts do decline, and the rate of damage to the DNA, for example, does go up. So we talk about how earlier is better, but we all know the stories about famous celebrities who've had a child well into their 70s. So it's not as the same time course as for females.
So we also see that females who may be wanting to have families later in life, they're freezing their eggs.
Yeah.
Are freezing sperm?
Yes, this is a thing. So freezing sperm is an easy and viable alternative for many men who wish to have something in the bank, so to speak. What happens is a man comes in and provides a specimen in the lab. We then very carefully freeze that using a particular protocol. And then we make sure it survives a thaw by checking it after thawing a small portion of it. Most men have plenty of sperm in a frozen sample for IVF. Some men have enough for other alternatives to IVF, but it's not the same as a natural conception. It always has to have some sort of assisted reproduction available. This is also a process that's not covered by insurance in most cases, and so there is a fee to it, although it's far less than egg freezing, which is good. On the other hand, however, many men come in and request sperm freezing before a vasectomy, and we now understand that from a population perspective, this may not be financially the best decision across all patients. Now, if it's not a financial stretch for that particular patient and they're interested in it, we're happy to do it. But we do have to have a discussion about that. And I think the policy of how we use this on a national scale will continue to evolve.
What are the treatments available?
For infertility, there are many treatments. As straightforward as talking about dietary changes, exercise, stopping smoking, maybe turning the car seat heaters down in your car if they're too warm and causing heat on the testicles. This is sort of the first bucket of conservative interventions, if you will. And because pregnancies are random and they don't happen every month, even for a healthy couple, sometimes it just takes longer. We say 15% every month for a healthy couple. That means 5 or 6 months of trying for a couple without any issues. So sometimes we just wait. In other cases, we need medications, and there are medications we can use for this problem. And then finally, there are some surgeries we do as well. The most common surgery is called a varicocele repair, which is a dilated set of veins above the testicle that we can fix with a 45-minute surgery. And this helps 80% of men who need it, and 40% of those couples then go on to have a pregnancy afterwards. In the most severe forms, we have to go in and surgically find sperm in the testicle. We basically cut the testicle open, and yes, it's barbaric, but that's what we do. And we use a microscope to look through the individual parts of the testicle and try and find that one needle in a haystack where there might be sperm. and then we use that for IVF.
Is it possible for a man to have a vasectomy reversed and then continue to develop sperm?
Absolutely. He never stopped making sperm, even though he had a vasectomy. We've simply interrupted the plumbing, and the sperm can't get out. Now, he still ejaculates because most of the ejaculate doesn't come from the testicles, it comes from elsewhere, but the sperm are obviously, by definition, trapped inside the testicle. A reversal is a really good option for many patients who desire fertility after having a vasectomy. It's about a 2-hour surgery, and the success rates, depending on several variables, can be as high as 95%. Many of those couples will then go on to have a natural pregnancy, and if they're unsuccessful, we can then use the sperm either in their ejaculate or that we froze at the time of their reversal to do IVF. So we think a reversal is a great option. And while we do say that a vasectomy is designed to be permanent, in reality, we do reversals every week.
Can they fail?
They can, and over time, you can imagine we're sewing together a structure that is smaller than a pencil lead using 10 sutures under the microscope. There's not a lot of room for error, and sometimes the repair does scar down and fail over time. And we don't know yet how best to prevent that or treat that. We have some options available to us, but yes, they can fail over time.
From your perspective, what's next on the horizon for male infertility?
I think that can take a lot of different flavors. I think generally speaking, we should talk about this problem. We should enable our male friends or male partners to speak about the condition and how they're coping with it and how they're stressed about it, and allow them to seek treatment. I think from a scientific perspective, we have a lot of work left to do in understanding the causes of male infertility. Almost half of cases are unexplained, where we can't give the man or the couple a particular cause, we just know that they're struggling. And then finally, for men with no sperm in their ejaculate, we are very interested in finding ways to help develop sperm for them in the dish using cutting-edge science. Now, that's many years away, but we are currently doing projects where, for example, for children who don't have sperm because they're before puberty, we're taking small bits of their testicle tissue before they have chemotherapy for their horrible pediatric cancer, and we're saving that. And then we're learning how to take that tissue and turn it into sperm such that we can help them with their fertility journey 20 years down the road, and we hope that science will catch up for when they're ready to have a child.
Wow, phenomenal insight. Dr. Lundy, as always, thank you.
Sure, absolutely. Thanks for having me here.
Trying to conceive a child when infertility issues are present can be a dark and depressing time for couples. It's not a time to suffer in silence, but to find comfort and support.
I strongly support seeking a therapist to help you through your mental health issues, and to engage in exercise, because exercise is a natural remedy for depression. Surrounding yourself with people that love and care about you and are going to support you and offer comfort to you during that time.
Dr. Vaughn shares what you can do for the loved ones in your life who may be struggling with infertility.
You want to try to come from a place of understanding and empathy. You want to be able to ask them what they need versus just assuming. You want to ask them what they need. And sometimes people will know what they need, sometimes they won't. And so for those that know what they need and, are willing to and open to communicate and vent about their feelings and their emotions, just give them the time, the opportunity, and the space to do that, and to listen to them without judgment.
Yeah.
And just be present. It's amazing how much listening and being present.
There are also things not to do for couples struggling. They include: don't try to fix their problem, or pass judgment, or minimize their feelings. That'll do it for this week's edition of Prescription for Life. Thank you so much for watching. We'll be back here next week with another dose. Until then, I'm Monica Robbins, wishing you and yours good health. Thank you so much for tuning into Health Yeah. Please find me on Twitter and Instagram at Monica Robbins. Like and follow my Facebook page, Monica Robbins WKYC. Find video podcasts at Monica Robbins' channel on YouTube. And please subscribe. Wishing you great health and hope to see you again soon.
Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.